Let's talk about, well, doctors on strike and doctors not helping working class men needing treatment for pancreatic cancer because, well, they simply don't attend hospitals. I'll talk to Professor Carol Sikora, Medical Director of Rutherford Cancer Centres. Good afternoon to you, Carol.
Good afternoon, Julia.
Thanks for joining us. Let's talk first of all about Wes Streeting, the Health Secretary. He's been in the news for lots of different reasons this week, but he's accused the striking doctors' union, the BMA, representing resident doctors, as they're now called, junior doctors previously, of behaving like a cartel over their pay demands. He basically says that that it was time for the BMA to get real. Increasingly clear, he said they're no longer a professional voice for doctors. They're behaving like a cartel, and they threaten not just the recovery of the NHS under this government, they threaten the future of the NHS, full stop. And he says it's a morally reprehensible position. Do you agree?
So it is a cartel. Of course it's a cartel. All unions are cartels. That's how they work, whether it's train drivers or doctors. They strive for their members to get the best deal. Whether it's fair that the doctors are going on strike now is another question. And Wes Streeting's handling it, I think, as well as he can. But he's meeting total resistance. And I think the reason for the resistance is not money. It's a complete disillusionment with the NHS and the whole operation of it, the way it works. And the fact that the doctors feel they've been pushed aside. In the old days, we looked after doctors. As a consultant, I looked after a firm of doctors, all greys, and we worked as a team. Yeah. And I knew their first names. They come to my house for Sunday lunch now and again. I went to my bosses for Sunday lunch. Yeah. That's all gone. Everyone works 8 hours and goes home. The NHS is not what it used to be. So we have to have different mechanisms to run it. And I think the young doctors see that. And that's why they're choosing to go to Australia, New Zealand, all these lovely places.
Well, they're paid more. Is the issue that we do need to pay them more? Look, although they've had in total that 29% pay increase since Labour have come to power, they still say it's still not enough. It's way more than other public sectors of workers have got. But they still say it's not enough to reinstitute their pay they would have been on back in 2008, which is a particular date they've chosen because it makes it look a lot worse than it was. But basically, everyone in the public sector and everyone in the private sector has done badly in recent years because of austerity and then also because of inflation. So, they're not any worse off. But do we just have a problem that actually we need to pay doctors more to keep them?
We have to give them more career options. At the moment, the trouble is, say you want to become an oncologist like me. In the old days, I went to see who I thought were the two top oncologists at the time, a long time ago, Julia, but I went to see them. They gave me a cup of coffee. They gave me 10 minutes of the time. And the guy I wanted to work for said, if I send you an application form for my registrar job, you'll have it in the post. Yeah. If I don't, you won't hear from me again. And that's what happened. I got the application form and started my career in oncology. And the trouble with that, you're in control of your future. Now they're not. I think the difficulty is what impact will it have on the NHS? It's going to be large. 5 days doesn't sound too long, but the roll-on effect of that, especially winter pressures are just building. Yeah. Winter pressures, of course, are an acronym. We know they're there. They're nothing that every year for 50 years we've had winter pressures. Old people get ill with chest infection, and there isn't the capacity to deal with them. And now there isn't the social care capacity to get them out of hospital, so it's compounded by that. Yeah. And there are a lot more old people. So this is the problem.
Yeah, I mean, it's only going to get worse rather than better, isn't it? And you mentioned, you're an oncologist. That's why I want to talk to you specifically today about prostate cancer. It's been very much in the news. Lots of, prominent people talking about, how important it is we need to tackle prostate cancer. And it is extraordinary, actually, the focus we had in the last 10, 20 years on breast cancer, how we have absolutely driven down the mortality rate from breast cancer because of that awareness and women checking and breast screenings and the like. But there's been a real move to move towards proper prostate cancer screening. And one of the reasons is the new data suggests that it's working class men with prostate cancer who are being left behind by the NHS. What's happening there?
The NHS is a complex system, and more educated people can handle complex system better than people with poorer education.
You mean sharp-elbowed middle classes?
Exactly. And the other problem is the way around it is to be assertive but not aggressive. And the difficulty, when you have to be nice to the reception, the people that are important in decision making in the NHS to you are not who you think. They're not the consultants. They're not the senior matron in a hospital. They're the little people that are totally undervalued by everybody. If you're nice to them, or even better, you give them a Christmas card or a bottle of wine to my secretary, it has so much more impact on the
I don't
patient's
think you should
journey.
have to do that. Look, I was a receptionist at a GP surgery where my mum was working after, after school, and I know how powerful the receptionist is, but I don't think you should have to be, other than, of course, professional and friendly and polite and respectful to people. Absolutely, goes without saying, surely. But isn't it a lot of it the fact that actually, as with all cancers and all long-term ailments, basically middle-class people go to the doctor with any minor ailment, and many people, on a lower income scale, they just don't, and they just go, well, I just feel terrible, and they don't go to see a doctor at all often, sadly, until it's too late. Is that why we need to have screening, so it's just automatically every man will be screened for it in the way that every woman gets screening for mammograms and cervical smears?
Men are much poorer than women at looking after themselves.
They're rubbish.
It's always been the case. They're too stoic. They want to avoid the doctor. With prostate cancer, the average age is 72 when you get prostate cancer. So it is the predominant retired folk. And grumpy old men don't like going to the doctor. Their wives often have to push them. And you see on the referral, the GP said that his wife brought him along to the surgery, and I'm referring him on to you. And the men are forced. So why screening is important for men is that it makes them do something about it. It gives them the incentive to actually go and get it sorted out. I think that's the real reason why the campaign is on.
Yeah, indeed. Professor Kowsker, great to get you on. Medical Director of Rutherford Cancer Centre. Thank you for that.